Plastic surgeons in Singapore are reporting a 30% jump in cosmetic works, mostly from patients under the age of 30. With social media glamorizing every nip and tuck, experts warn that this could lead to a growing risk of addiction. Nadine Yeam reports.
Jade Rasif was 19 when she first went under the knife for a breast enlargement procedure in Thailand.
And I didn't regret it. I loved it so much that I got a couple more.
She since had procedures like nose jobs, lip fillers and Botox, and shares her journey online to a new generation interested in plastic surgery. It was often those over the age of 40 who went to plastic surgeons to look for ways to reduce their aging and restore their youth. But as doctors have shared with me, it is now those under 30 who are driving the demand for consultations. The more common procedures in Singapore include upper and lower eyelid surgeries, nose reshaping and body contouring. And the reasons for doing so are plenty.
A lot of them are just doing it for themselves and they believe it will help with their self-confidence, their self-esteem. And I think we are seeing a lot of people glamorizing cosmetic work or openly sharing their cosmetic treatments. That has normalized certain perceptions that used to have a stigma around them. And I think that has sort of urged people to seek intervention or treatment of certain conditions.
Doctors say the actual number of people getting plastic surgery could be more, especially as it's easy to travel abroad to get beauty at a budget. Take, for example, one of the most popular procedures, rhinoplasty or a nose reshaping job. In Singapore, that costs between 5,000 and 25,000 Singapore dollars. But in South Korea, it's as low as $2,900.
Singapore is one of the costliest countries in the world to live. As doctors as well, we face costs and pressure costs as well. So unfortunately, that may sometimes translate to the patient.
Another concern doctors raised was the possibility of addiction. Currently, doctors rely on a patient's motivations and medical history to make that call. Some have turned down patients when they spot underlying psychological conditions, like those who obsessively worry about perceived flaws in their appearance.
You want to prevent a younger population from being addicted to plastic surgery. And I think the only way to do that is via proper education, to tell them these are the risks involved, number one. Number two, these are the targets we are going to achieve. So we set the boundaries right from the start. And number three, if need be, further evaluation by another healthcare worker.
Ms. Rasif agrees. For those still considering to get work done, this is her advice.
So when you're thinking of cost cutting, you're thinking of procedures, please think 10 years, are you going to be happy with it? 20 years, are you going to be happy with it? And also, like, when a lot of people get surgery, especially at a young age, including me, right, 19, 20, you are sort of trying to make yourself fit and ideal. And that ideal is somebody else's ideal.
With more people going under the knife, the number of botched jobs has also climbed. Between 2022 and 2024, the Health Ministry investigated around 90 cases of unauthorised people performing medical procedures. That is a 50% increase from the previous 2 years. Some images in this report are of a surgical nature, and Rohim tells us more.
5 years ago, Georgina Poh wanted a new smile by turning up the corners of her lips. But the surgery in Singapore left a bad taste in her mouth. Recovery was tough, with the stitches making it hard for her to eat and drink. After about a year, the scars remain.
The clinic told me I'm the first one who did the smile surgery there. Yeah, but for online reviews for plastic surgery in Singapore, they are not allowed to post after. So no matter what we ask, they also can't really tell us the after effect.
Lawyers who handle disputes over medical treatment say it's not that easy to prove if a doctor has performed their duties up to standard. It takes time for patients to know if what they have gone through is correct, and even longer to prove if there was negligence.
Most of the time, the lawyers will engage an expert. And a lot of times the experts comes from outside Singapore, and maybe Korea or maybe the US or something like that. And they will then go through the clinical notes. Only the expert can tell whether a doctor is negligent or not negligent. Then from there you can build up your case.
Lawyers told me, well, there seems to be a rising number of complaints or issues related to aesthetic procedures. Not all cases go to court. In fact, most of them are privately settled with the doctors. And in terms of aesthetic clinics, breaches of duties could arise when they improperly delegate to those who aren't trained or offer treatments that aren't covered under guidelines. And with more non-registered individuals offering services in homes or hotel rooms, making a claim may not be so straightforward when things go wrong.
Some plastic surgeons report that 1 in 10 botched jobs come from overseas or unregistered practitioners. Dermatologist Dr. Evelyn Tay says problems include infections from fillers and skin tissue loss. She adds that the different treatment options promoted on social media can also confuse patients.
There's a lot of new treatment that's always constantly coming out because it's a very competitive field, but sometimes it's good to just pull back a little bit and just let the treatment launch in the market first, see what the general feedback is like, get a bit more experience and a feel of the product before launching in your own clinic.
Ultimately, experts say the safest move for patients is to do their homework first and be sure of their choice before committing to any procedure.